Assalamu alaikum. Good afternoon, everyone. Ladies and gentlemen, welcome to our webinar today. My name is Dr. Mohammed Al Ghamdi, and today I'll be talking to you about update on COVID-19. We will start first by giving you a brief update on the COVID-19 across the world. As many of us knows that the virus started in 2019 in a city called Wuhan in China that caused basically pneumonia, and later on the disease has spread and caused pandemic across the globe. The numbers are still in the rise, and as you see from this slide, actually the numbers has increased significantly of what we called in some of the countries as second wave. So we have seen first the first peak that started, and then certain numbers went down in certain countries, and again the numbers has went up significantly, and we still see a very record numbers in certain countries due to the spread of infection. The reason why many of the countries has actually witnessed a second wave is mostly related to the ease on the precautionary measure and the prevention measure. The disease so far has affected over 59 million and caused almost 1,400,000 deaths. And these numbers are actually have increased day by day, which mean actually we are still facing a major issue with this virus, causing many infection across the world. Again, certain countries that have seen a second wave or even a third wave has mostly related to the lack and the relaxation on the precautionary measures, where people start, unfortunately, to take it easy and they don't follow the basic prevention measures such as wearing mask, avoiding keeping the distance, and also the hand sanitization. In certain countries, basically, they have seen an increase once they actually those measure has been taken away, or there was an ease in following those measures. In the kingdom, alhamdulillah, we have seen the number trending down, and as you see from the graph, the numbers has actually been in the lower part, and almost those numbers were really back to the initial days where we had COVID-19 early in the year. And this is because basically people actually have taken the measure seriously. And this is, I would say, a community effort that everybody has actually stepped in and follow the precautionary measure that has been recommended by Ministry of Health. So this is very good. And I think the kingdom have taken an excellent step through Ministry of Health by orienting the people, by educating the people about the preventive measure, by taking some of the most important measure early on, that's include the early lockdown, as all of us remember. And then after that, bringing the test on board, where a lot of us actually had access to the testing, and those are very important to control any pandemic, where people can be tested and know if they are positive, and after that, those people will be quarantined. And the fourth step that was very important by all of us, and we contributed in JHAH here to this kingdom effort, is the tracing for all the contact related to the positive cases, where all of these cases has been quarantined and advised to stay at home and stay away from close proximity to their family, and that actually prevented the spread of infection. This is very important to continue. We have seen the effect of following precautionary measures. We have seen the effect of following social distancing and masking, and I think we need to continue doing this step. This step is extremely important to control the infection for the long period of time until we have, inshallah, the vaccine on site and everybody is vaccinated, to make sure that we don't ease on those early on. That will immediately reflect in the numbers for sure. Will witness a second wave, God forbid, if people start easing on those. Now, I just want to remind everybody how COVID-19 are spreading. This is a disease that spread by droplets, which basically when someone cough or sneeze, especially in close proximity. People who are in close contact, basically when you touch or shake someone else's hand and without washing or sanitizing your hand, you could easily get the virus. Touching surfaces without cleaning your hand and then touching your mouth or nose actually is a way to get the virus. If you are living with someone who has who are positive to COVID-19, or you are close in contact with someone who are positive COVID-19 without observing those, then the likelihood of you getting the infection is high. Those viruses stays in surfaces for a number of hours. They can stay in the air for a number of hours. So that's very important that if someone is positive, they need to be isolated. And the rest of the family actually need to stay away if they are at home, and also avoid actually visiting facilities or healthcare facility that has cases with COVID-19. The chances of people there getting infection when they visit those facilities is high also. That's why we need to continue monitoring and making sure that when we are in close proximity, we make sure that we follow the precautionary measure, and also not to touch surfaces that could be infected or exposed to the virus. So the interesting question has been how long it takes between infection and symptoms to start. And most of the study had actually, it's difficult to estimate the actual time, but most of the evidence that we have is that the average period to show symptoms between the infection and the start of the symptoms is around 4 days. Almost 97.5% of the infected patient symptoms will start, will have symptoms within 11.5 days. And a small percentage of patients actually can have symptoms beyond 14 days. So you can imagine someone who are infected, they don't show up symptoms, and they stay for 2 weeks asymptomatic, and they could show symptoms at the end of the period of time, and this is will lead actually to higher rate of infection, because those people doesn't present with symptoms. The likelihood of you're getting in touch or contact with someone is very high. So that's why you cannot assume if someone doesn't have symptoms that they are not infectious. That we are seeing in second wave. People doesn't feel symptoms, they're likely to be in close contact with the other people. They don't have, they either have no symptoms or very small symptoms or low-grade symptoms, like a very low-grade fever or just myalgia or headache. And then after that, those people will go out, and they likely, if they don't follow the precaution measure, they will infect other people. So it's very important that we continue to make sure that that even if we don't show up symptoms, that the chance that people could have the virus.
Doctor, we can see the slides. The slides are not showing.
Okay, sorry. I'll try to see.
Okay, الحين اتغيرت. Yes.
Okay.
Now it's changing. Thank you.
Thank you. Sorry for that. So hopefully you can see the slides now. So why some people are sicker than the others with COVID-19 is because people with comorbidities, such as some people with high-risk diseases, can actually develop a very severe illness. And that's what actually drive most of the death from COVID-19. People who have diabetes, and we know that diabetes is a major issue in the kingdom, with almost 25% of adults have diabetes. Also kidney disease, people who have on dialysis, which mean that they are actually receiving treatment because their kidney is not functioning. Those people are at a high risk of also getting a severe disease and being admitted to the hospital. People with cancer, people who smoke, people who are obese or overweight. The kingdom actually have very high incidence of overweight, and that's why it's extremely important that that those people are the highest risk. These are the people who get admitted to the hospital, and these are the people who can go into the intensive care. So it's extremely important to even protect these people. Because what happened is that you may have a family member, because you're healthy otherwise, you may go around and socialize, get the virus, and then uh, um, take that virus to the close to your family or the people who are close to you who may suffer from one of these diseases. And then unfortunately, those people will end up with being hospitalized and being in ICU. And unfortunately, they may suffer consequences related to COVID-19 pneumonia and even death. So what are the clinical features, which mean what are the symptoms actually people develop if they have COVID-19? Now, respiratory symptoms are the main thing, which mainly cough, which present around 50% of the cases. 50% of the cases will have mild cough. Fever is up to 43%, difficulty in breathing, and people can present with pneumonia. There are other symptoms that people can present with, which include difficulty in breathing. They can present with myalgia or arthralgia, which is joint pain and achiness. And in severe cases, those patients can actually present with pneumonia, and they actually can have kidney failures. And unfortunately, once they are admitted to the ICU or intensive care because of the advanced pneumonia they will have, then there are chances of, unfortunately, people pass away from that disease. It's a multi-system disease, although it is mostly in the lung, but actually we have seen complications related to it that affect other parts of the body. So it is a very serious disease, and people need actually to take it seriously and keep vigilant in regard to the precautionary measures that we have talked about. Can you have an infection without symptoms? Of course, yes. And we talked about this before. Actually, you can be infected with the virus and then recover also from the infection, and you will not have symptoms. The percentage can be very high. In certain studies, it had been estimated to be around 40% of people that can have infection without showing any symptoms. Or some of these people actually may have very mild symptoms such as low-grade fever. And the problem with this, those are the people who would be around and will not feel sick, and the chances of infecting other people is high. So we have to keep vigilance, and we have to know that this is a high rate among people who doesn't have the infection that actually doesn't show up symptoms. So the question is this a COVID-19 or this is a flu? We are coming to the cold season. Temperature are dropping down, and many of us can actually experience some of the cold symptoms. I wouldn't go to, and I wouldn't advise people to start self-diagnosing whether it's COVID-19 or flu. If you have to have fever, what I'm advising people is actually a healthcare provider and get assessment. It is very difficult even for some of us as a health practitioner to differentiate between COVID-19 and flu, because they share many of these symptoms, such as low-grade fever. You can have a sore throat, you can have a cough from either COVID-19 or a flu. So it's very important that if you had sickness in a way or another, that you get assessed by a medical practitioner and get tested if needed, just to make sure that you don't spread. Flu, most of the people can survive. We have a flu vaccine. COVID-19, we have, yes, we have vaccines, but not yet available. And the potential of getting a serious complication out of COVID-19 is high. So I want you to when you have symptoms, to seek medical advice and to make sure that you are okay. Now, we know that prevention works, and prevention work, and you have seen the numbers in the kingdom going down because of many measures that has been implemented by us, and the government and Ministry of Health did a fantastic job educating the people and enforcing the social distancing and masking. We are so proud of what the kingdom did actually to control this infection. We are one of the best country, I think, in the world that have did a fantastic job controlling the disease. So I want to remind you that actually prevention does work. And the most preventive measure is basically what we call is the 3 Ws. So first is wear a mask. Wearing a mask is very important. And wearing a mask is not only actually to protect other, but actually it protects as someone who putting the mask from getting an infection from others. So it works both ways. And number two is always try to wash and sanitize your hand whenever you touch surfaces, whenever you touch going from bathrooms, public bathrooms, shopping, going to restaurants, meeting some people in a different way or another. Make sure you sanitize and you wash your hands. And then watch your distance. You have to keep at least 2 meter distance between you and other people. So the typical ways of keeping your hand hygiene is the two main methods, was basically either washing them or soap and water, or use an antiseptic gel. The critical part here is two things. Number one, you have to be aware of the technique and how to wash and sanitize your hand. You have to cross your fingers. You have to cover between your fingers. You have to cover your palm of your hands. There's videos and a couple of videos on our website to show you what is the proper technique to do that. And it's extremely important because in order for you to get that effectiveness from hand hygiene, is you have to do it in the proper way. And you have to do it for the time that's enough to kill the virus. For hand hygiene, for washing, you need to do it for 40 to 60 seconds. Using an antiseptic gel is more practical and I think is very effective. And I think we should always do that. And it take only 20 to 30 seconds with the proper technique to have this intervention effective. So it is very important for us to use hand sanitization whenever appropriate. If you use a surgical mask or use a cloth mask, it is very important to follow the typical or the important step to ensure that this is a very effective measure. One of them is basically before you put your cloth mask or you put your surgical mask, is you have to sanitize your hand and wash your hand. And you have to do that also when you basically during wearing the mask, you shouldn't be touching your mask and touching your nose, because you're trying. You could have your mask could have actually caught the virus, and then you basically self-infect with the same virus. And the other one is that before you remove the mask and after you remove the mask, you should have a chance to sanitize your hand and wash it. And if this is a fabric, if this is a cloth mask, then make sure that it could be you wash it after each use. So these slides are basically to explain that whenever you use a mask, you have to cover all your face and it has to be properly fitted. Otherwise, it would impact you. So, and most of the time when we go to malls and everything, you've seen the people who basically putting the mask and they just only cover their mouth. That doesn't give you that effect. You still have your nose and you can get infected or you can spread infection. So it have to cover your nose and mouth completely. It have to be secured and it has to be a multiple layer. So if you're not using a surgical mask and you use a cloth mask, you have to make sure that it's multiple layer that you are using, and that will be effective, hopefully, to prevent the spread of the droplets, which is the vehicle where the virus actually get transmitted. And then if you use a cloth mask, you should be able every single day, and it shouldn't be damaged with the washing. So it have to be an intact material even with washing. Most of us are mask, which is a disposable one. The issue is, please make sure that you don't keep that mask. You should be using it for a period of time, and then if it gets soiled, then you need to dispose it and clean your hands. So surgical mask is also very important to get rid of them once you use them for a period of time, and they are meant for a single use. Shared environment, and a lot of us are working from in different environment. A lot of us have shared equipment. So as an employee, as also household, we used to use computers. You can use keypad, mouses. You can use a physical space. Most of us actually use a common space even at work. So, coffee places, washrooms, these areas are actually a way to spread the virus. It's very important that if you are using a shared keyboard or a mouse, that you make sure that you clean those and wipe those carefully before you use it and after you use it. It's extremely important because those are the areas where actually virus can stay for a long period of time, and unfortunately not much attention are paid to it, and then people get infected. So there are multiple opportunity for us to use hand hygiene. And in this slide, I'm just sharing with you a few of those moments, and this are actually available on our website for you to review. Each time I think you come close to a service, or you go to a different physical space, or you touch a service that is not your common service, if you meet people, if you read a magazine, if you come from lunch, if you use a colleague keyboard or a tool, then make sure that those are cleaned and sanitized before you touch them. Make sure your hands are cleaned, and whenever you finish, also you do the same. So before and after each activity, if you can sanitize your hand, that will actually reduce the risk of infection. Remember, smartphones, stuff that you take with you and to carry with you, that we don't pay attention to, are more likely to carry the virus because you have less chance of cleaning them. So it's very important that those stuff are actually get wiped or cleaned to prevent the spread of infection. I think our smartphone are a fantastic vehicle to spread germs and infection because we don't clean them as much as we do, and we take them everywhere with us. So please make sure that whenever you do that, you have the chance to clean those devices and places. Social distancing is extremely important. We know that the virus and droplets can travel so far. So if you don't keep that distance, the likelihood that you will be exposed to a droplet is also high. We have been around, and all of us have been to the local communities, and unfortunately, not the social distancing is not observed in many of these places. And I think we need to be advocate for the community. And I think we in JHAH and you as a community, you should be an advisory for the community. Hearing this from me is that advise other people if you see them not observing those social distancing. We have to advise each other, and we have to support each other and remind each other of those preventive measures. Otherwise, we will unfortunately see another spike if people start to ease, especially with the vaccine and everything that is in people's mind. I think people will tend to ease on those, which is really bad. That we could have really another spike of cases if we don't remind people to those very basic precautionary measures. So we'll move now to the update. I'm going to give you an update about the COVID vaccine. This is a very hot topic, and I think all of us are actually reading different materials in the news paper, listening to TV, reading social media. And the problem that is there's a lot of information there that could be true and could not be true. Some of these information are sometimes misleading. And I'm here just to give you the basic information that you can rely on. And at the end of it, I'll give you a piece of advice on how to follow up the vaccine update. So what is a vaccine? A vaccine is basically a germ, which is the bacteria or the virus itself, that we use part of it or the same virus, but we deal with it in a different way. We give it to the people, and the idea is you stimulate their immune response to produce an antibodies, and these antibodies is to protect the people against the disease. We are basically saying that we are training our immune system to protect us from those diseases. So any vaccine efficacy, which is very important. So we don't use vaccines that are not effective. If they are not effective, they are to protect the people. The efficacy depends on many factors. Some of these factors are the disease itself, the type of vaccine. There is so many types of ways that you can develop a vaccine. the schedule of the vaccine. So if the vaccine have multiple doses, there is tendency for people to not to follow up with the schedule, and it depends also on the body response to those vaccines. The most of us has been vaccinated during our childhood, and we are very familiar with the term of the vaccine and the scheduling. But the common type of the vaccine that we use to see and have is either a virus that causes the infection, but we inactivate that virus. That means it doesn't cause an infection in your body when it is in, although same virus, we inactivate it, it doesn't replicate, it doesn't harm the body. The other type is the vaccine that had been weakened or what we call attenuated. We change the genetic material of the virus so it doesn't replicate, it doesn't actually cause you the disease. And the vaccine that we take part of the virus, not the whole virus, part of the virus, and that part will be enough to stimulate your immune response to that vaccine. So this is the common type of vaccines that we have developed over years. So when it comes to COVID-19 vaccine types, there are different types of vaccines that have been developed, and these are different based on basically what are the material that used to develop the vaccine, and also and the technique that the vaccine has been developed for. So in general, the most common vaccines that have been developed for COVID-19 is inactivated vaccine, which is basically what I have explained, that you take the virus and you actually deal with it in a way that it doesn't replicate in the body, or a weakened vaccine, which is basically doesn't cause an infection, or use part of the vaccine. And we have a fourth type, which is called vector type. And vector type is basically you take part of the virus, you put it in another virus, use that other virus as a vehicle, as a vehicle to transport that material to the body. So it's like basically not your own car. You take another car and you have yourself in it and you drive. It's just basically a delivery mechanism of the material of the virus to the body. And the fifth type, which is the DNA or RNA vaccine, I'm sure you have seen in the media a lot of discussion about the RNA vaccines. And these are the ones that we're going to talk about in this lecture. And it's basically a genetic material, and that genetic material actually is coded for a protein, and that protein, once it goes into the body, it goes into the genetic material of the cells, of the immune cells, and it tells the immune cells build up that protein, and once it builds that protein, the body knows the protein and start developing an antibodies against it, against that protein. So it is a new way of developing vaccine. This is probably the first vaccine that was developed in such way, and it has its own limitation, which we're going to be discussing in the next slide. So moving on, I just want you to understand what vaccine development stages that usually goes through. And this is important for you to understand how safe are those vaccines. Take vaccine that just tested in animals and give it to people, because we don't know the side effect of those vaccine. So in general, any vaccine, when it comes from the time where we develop that vaccine until it's delivered to people, there is so many phases, there is so many safety and regulation measures that take place to make sure that that vaccine is effective and safe. So the two words that is critical in those trials are efficacy and safety. So you'll see those two words are actually in most of the media and also in literature, our journal literature that is pertaining to the medical professionals. So a vaccine pass through stages to ensure safety. Most of these stages, to simplify it for you, is something that we called preclinical studies, which is basically testing in non-human. So the first testing is they test it in mice, they test it in chimpanzees, they test it in different animals just to see the response of the immune system, and if they are exposed to the disease, those animals, would they have been protected by the vaccine? That's before the human trials. Then we move to the second stage, which is the human studies or the clinical trials. And in general, these are usually go through 3 phases. Each phase has a very specific, unique outcome, which is basically phase 1 in general are vaccines that are tested in few participants. And when we say few, they are usually less than 100 that we test for safety. So we give the vaccine to those people. Usually they are healthy people with a certain age group with no major health issues. And then we test their response, we measure their antibodies, and again, we also look at the dose. We see how appropriate, small, can we escalate the dose further to produce more immune response? And if we escalate the dose further to produce an immune response, is there any issues or safety? So there's always in those phases a very intense measurement of any side effect, because these are the initial stages, and you want to actually prevent anything that could have been harm or could be a bad adverse effect early on before the vaccine get rolled out into the second phases, which is usually a large group of people. Now, in second phase, testing is done on a large group of participants, which is beyond 100. And again, in this stage, there's a huge focus on safety, and there is also to see how good is the response of the body to that vaccine. These trials goes for a good period of time, just to make sure that those vaccines are safe, and anything that gets reported get basically investigated to make sure, is this related to the vaccine or something else? So it is extremely important to have that control. In phase 3, which is I think most of us outside there are hearing. So we hear a lot of time, oh, this vaccine is in phase 3. What does that mean? Phase 3 means that the vaccine now are tested in a very large group of people, and this is basically the final stage before the vaccine get actually approval and then get manufactured. So phase 3 is extremely important because you are engaging thousands of people. We are talking about in COVID-19, which I will explain, 30 to 40,000 people are engaged in that study. And the reason why you want to engage a lot of people like this, because you really want to make sure that this vaccine is safe at a very large group of people. And as you can see from the table, the number of vaccine that so far has taken place. So the phases, if you look at the phases in the table, there was 13 of those almost 2 weeks ago on phase 3, and there is 17 in phase 2 and 37 in phase 1. So the vaccines who pass the preclinical studies and reach the clinical trials, which mean that were tested in human, are about 54. But in the preclinical, there is almost 87, and there is 6 of those who reach phase 3 has limited approval to be used. And when we say limited approval, this is what you hear about the emergency approval for the vaccine, and in certain countries, they will allow this before to give it to the general public of the community. So this is in short, what do we mean by clinical trials and what do we mean by phase 3? So what are the vaccines that are available for COVID-19? And I'm sharing with you some of these top vaccines that have reached to or completed phase 3, and they have published data or have been approved in certain country to be given to the community. Again, the base of approval and the base of development of COVID-19 vaccine are extremely fast. And sometimes it's very difficult actually to keep up with how many of those vaccines are approved and how many of those vaccines. But in general, you are seeing in this table the top ones. And let me point out these what have been through and what have been done for those vaccines. So there is almost 151 candidates that are on the preclinical trial that we talked about. And again, if you look at the numbers of people who went into phase 3, there are close to 30 people that have been participated. Most of these are given as an injection, and I think most of us are used to that. Most of these vaccine is injectable, and There are few vaccines that could be given through different routes, but they are still not reached to phase 3 clinical trial. Let me highlight from the table the big runner for the kingdom here, and also that has been approved elsewhere. And I think all of us became familiar with Pfizer's vaccine. So Pfizer vaccine are a messenger RNA vaccine, which we explained before. The vaccine has efficacy based on phase 3 trials. That's fantastic. It's a 95% efficacy rate, and there is no major side effect out of that vaccine. And Pfizer's has been approved in the kingdom, and I think all of us become happy about the news that was spread recently. We are not the first country that approved Pfizer's vaccine. It has been approved in the UK, which was the first country, then Canada, and also Bahrain has also approved the vaccine, and including Kingdom. And hopefully we're going to see the vaccine, inshallah, in the Kingdom very soon. There was the Ministry of Health announcement that Pfizer vaccine will be available toward end of December. Hopefully they will start the vaccine based on the stratification and the category they have decided and the priority for people to get that vaccine. I think the other vaccine that is coming to place also is the Moderna vaccine, which is also the same. They have developed the same way that Pfizer's have developed, which is an RNA vaccine, which is basically taking part of and the other one is coming on board is also the Oxford AstraZeneca vaccine. This is a vector, viral vector, basically mode of development of vaccine, which is different from the messenger RNA vaccine. Now, in the kingdom, I think we will be seeing Pfizer's and Moderna and also Oxford hopefully soon. The one announced so far is Pfizer's. We need to get an update on the other one. So far, we didn't know which one will be first. But those vaccine, when they are out, it has a lot of logistic issue to get it to the community. So we need to be very patient with those. And I think most of us know on the other part that Sinopharm, which is this one, has been already approved in the United Arab Emirates, and they are starting vaccinating people. So most of these vaccine are 2 doses vaccine, which mean if you receive 1 dose, you will need another dose and maybe 3 weeks which is basically 21 days to activate your immune response. And the reason why you should receive 2 doses is because once you send a signal to the immune system, you want the system you provoke the immune system to a certain level of efficacy. But if you give it another shot, then your immune response will become much better and higher. And that's what we need, is that if those vaccines become available to everyone, you need to stick to the schedule because that will give you the protection rate we want. And the side effect that has been basically reported are very minimum. So in the studies that has been done for Pfizer vaccine, some of the people had a small local side effect, which would include a minor reaction and pain at the site of infection. Later on, they could develop mild symptoms such as fever and arthralgia and headache. These are symptoms that you develop with some other vaccines, like the flu vaccine or others. So, and based on the safety data that we have seen, was no major side effect of those vaccines. So they are so far pretty safe, and hopefully we will be seeing them. They will be given to the large population soon. So hopefully in the kingdom, I think most of us have seen the announcement that these vaccine will be available in from the first quarter until the third quarter. That inshallah the majority of our people in the kingdom will be vaccinated throughout those months. So I think we know about Pfizer's that would be coming to the kingdom, but I want you to share with you and what exactly, if the vaccine is available, why it take us long and a couple of months to get that vaccine? So Some of it is related to efficacy and established efficacy. Some of these vaccine need to prove that they are effective. The second thing is licensing and vaccine. So I think most of us have seen in the news the Saudi FDA approving the vaccine here, which means that once those vaccines are taken by a country, they're generally reviewed by a committee, which is a subject matter expert committee. And those are usually infectious disease, public health, virologists, and they will look to the data that has been provided by those companies. And why is that? They want to make sure that those vaccines are safe and these data are reviewed before they give it to the people. That's why most of the countries will require this from a safety point before they give it to the community, so they can decide on whether to roll out those vaccines to the public. And the other part, which can sometimes be challenging, is some of these vaccines, especially the one that develops like the messenger RNA vaccine, are difficult sometimes to ship and store. So some of the vaccine you have seen that have to be stored at very low temperatures, such as minus 70 degrees, which is basically applied to Pfizer's. But the other vaccine may actually be stored at less lower temperature, and hopefully these logistics will not be a major challenge in giving it to the community. But you can see that this may take time, and we need to be patient, and we need to follow the precautionary measures until hopefully all the pieces come together and we'll have those vaccines available on our community and can be easily administered. So why I'm here talking to you is, first, I want to keep you updated with the COVID-19 vaccine. I want to tell you that COVID is still around. And the reason why COVID is still a low number in the kingdom is because of all your contribution to the precautionary measures. So please, my appeal to you is that continue to follow those precautionary measures. It will take some time for the vaccine to become available to us. It may take us few months to have all the people vaccinated. During those months is extremely important to continue doing what we are continuing to doing now. We still, even if the vaccine is 90% effective or 95% effective, you still have 5%, and 5% is huge number of patients or huge number of people that could actually still be exposed. Could be your loved one or your family. So what I want is basically that until we have the herd immunity, which basically everybody is immunized in the community, that we continue to do the precautionary measures. We get used to it. We have been, alhamdulillah, living almost normally with those even precaution. It's part of our life. And trust me, it doesn't only protect you from COVID, it protect you from other viruses that is there. The vaccine is very promising. We are almost there. We are seeing at least a light, a light at the end of the tunnel. But it is our responsibility to continue doing whatever it's right. And what's right is basically following the precaution measures to protect ourselves and our loved one, our family, and especially the people who are at higher risk. So at this, I'll stop and thank you for so much for giving me the chance to talk to you today. And if there is any question, I'm happy to answer. So you can put your question through the chat, and I will do the best I can to answer it. Again, thank you very much for giving me the chance to talk to you today, and hopefully we'll go over the question to answer. Okay, I think I'm not seeing many questions there. So I think I will give it another 1 minute, 2 minutes, and we'll close if there is no question from the participants. Okay, I think there was no further questions. So again, thank you very much, and hopefully we'll see you in another JHAH webinar soon. Have a great day and stay safe, please. Assalamu alaikum.